There is a strange thing about constipation. It can become part of your life so gradually that you stop thinking of it as a medical problem. A few days pass, your stomach feels heavier, you sit in the bathroom longer than usual, nothing happens, and eventually you tell yourself the same thing millions of people have told themselves. Maybe I just need more fiber. But what if that is not the whole story? Because constipation is not simply about how often you go to the bathroom. Doctors also look at whether stools are hard or difficult to pass, whether you feel that you have not completely emptied your bowel, and how long the problem has been happening. In fact, people can have very different normal bowel patterns, so frequency alone does not tell the entire story. And that creates our first mystery. How can something as ordinary as a bowel movement become difficult when a person otherwise feels completely healthy? There may be no fever, no obvious injury, no dramatic pain. You may be eating normally, working normally, and going through your day as usual. Yet something inside the digestive system is moving differently. And sometimes the difference is not what you are eating, it is what your intestine is doing with it. Why this matters. Constipation is remarkably common. NIDDK estimates that about 16 out of every 100 adults in the United States have symptoms of constipation. Among adults aged 60 and older, the estimate rises to about 1 in 3. That means this is not a rare digestive problem affecting only a small group of people. It is something doctors see across ages and populations. But there is another reason the subject is more complicated than it appears. Constipation is not a single disease with one single cause. It can happen because stool moves too slowly through the colon. It can happen because the muscles and nerves involved in emptying the bowel are not coordinating properly. It can be associated with disorders such as irritable bowel syndrome. And medications, changes in daily routine, aging, dehydration, low physical activity, and certain medical conditions can all play a role. In other words, two people can have exactly the same complaint. I am constipated. But the biological reason behind that complaint may be completely different, and that is where this investigation begins. The journey nobody thinks about. Every day, your digestive system is moving material through a long, complicated pathway. Food enters the stomach. It passes into the small intestine, where much of the digestion and absorption takes place. Eventually, what remains reaches the colon, and this is where an important transformation begins. The colon does not simply store waste. It absorbs water and gradually changes the material inside it as it moves toward the rectum. The muscles in the intestinal wall contract in coordinated patterns. The nervous system helps regulate those movements, and eventually, signals tell you that it is time to empty the bowel. Most of the time, you never notice any of this. That is the remarkable part. A process involving muscles, nerves, fluids, pressure, sensation, and timing happens quietly in the background, until something changes. If movement through the colon becomes slower, more water can be absorbed from the stool. The result can be harder, drier stool that becomes more difficult to pass. NIDDK lists slow movement of stool through the colon as one recognized cause of constipation. But slow movement is only one possibility, because the stool can reach the final stage of the journey and still fail to leave the body normally, when the problem is at the exit. Imagine a person who feels the urge to have a bowel movement. They sit down, they try, but instead of the muscles relaxing and coordinating smoothly, something is not working properly. The problem may involve the pelvic floor, the group of muscles that helps control bowel emptying. This is one reason doctors sometimes investigate not just how quickly stool travels through the colon, but how effectively the final part of the bowel can empty. In some people with chronic constipation, the problem is related to difficulty coordinating these muscles. And that changes the investigation completely. Because now, adding more fiber is not automatically the answer to every case. The question becomes, where exactly is the system failing? Is the stool moving too slowly? Is the pelvic floor not coordinating correctly? Is the bowel unusually sensitive? Is another digestive disorder involved? Or is something outside the digestive system affecting it? These questions are why doctors take a detailed history rather than simply asking someone what they ate yesterday. They may ask how long the symptoms have been present, how often bowel movements occur, what the stool looks like, whether there is pain, whether there has been weight change, what medications and supplements the person takes, and whether there is a family history of digestive disease. The answers can begin to reveal which part of the system deserves closer attention. The medication clue. There is another suspect that is easy to overlook: medication. Some medicines can make constipation more likely. These include certain antacids, some anticholinergic medicines, calcium channel blockers, diuretics, iron supplements, some medicines used for Parkinson's disease, opioid pain medicines, and some medications used to treat depression. This does not mean a person should stop taking a medication because they suspect it is causing constipation. That decision belongs with a healthcare professional. But medically, the connection matters, because sometimes the digestive system itself is not the original problem. The change may have started somewhere else, and that is an important lesson in medicine. The symptom is not always located where the cause is. The aging question. Then there is age. Constipation becomes more common among older adults, but saying it is just aging can hide several different processes. As people get older, physical activity may change, diet may change, fluid intake may change, medications become more common, certain chronic diseases become more common, and the muscles and nerves involved in normal bowel function can also be affected by age-related changes. So, aging may contribute, but it is not necessarily the entire explanation. That distinction matters because the same symptom can have very different meanings in different people. A younger person with occasional constipation after a change in routine may have a very different situation from an older person who develops persistent constipation accompanied by unexplained weight loss. And this is where the investigation becomes more serious. When constipation is more than constipation. Most constipation is not an emergency, but there are symptoms doctors do not want people to simply ignore. NIDDK advises seeking prompt medical attention when constipation occurs with rectal bleeding or blood in the stool, constant abdominal pain, inability to pass gas, vomiting, fever, lower back pain, or unexplained weight loss. These warning signs do not automatically mean something dangerous is happening. They mean the symptom deserves medical evaluation rather than assumptions, and that distinction is important. The purpose of an investigation is not to make an ordinary symptom frightening. It is to understand when an ordinary symptom stops looking ordinary. Because constipation can sometimes be a symptom of conditions affecting metabolism, hormones, the nervous system, or the structure of the digestive tract. NIDDK also lists conditions such as diabetes, hypothyroidism, celiac disease, neurological disorders, intestinal obstruction, and certain anatomical problems among possible causes. So the simple story begins to fall apart. Maybe constipation is not simply a problem of what goes into the body. Maybe it is also a problem of movement, communication, timing, and coordination. And there is one more question. If the digestive system is such a precisely controlled machine, what happens when the problem is not the stool itself, but the system responsible for moving it? That takes us deeper into the colon, the nervous system, the pelvic floor, and the conditions that can turn an occasional inconvenience into chronic constipation. And that is where the real mystery begins. By now, one thing should be clear. Constipation is not always a simple story about what someone eats. For some people, the problem begins with movement. The intestine is not a passive tube waiting for food to pass through it. It is an active system, constantly contracting and relaxing to move its contents forward. When those movements become slower or less coordinated, stool can remain in the colon for longer, and that can change everything. The longer stool remains in the colon, the more water can be absorbed from it. What began as ordinary intestinal contents can gradually become harder, drier, and more difficult to pass. But even here, there is another mystery. Why does this happen to some people, while others with similar diets seem to have no problem at all? One possibility involves the nerves and muscles that control the bowel. The colon relies on a complex communication system involving the enteric nervous system, the muscles of the intestinal wall, and signals from the brain and the rest of the body. If those signals are disrupted, bowel movement can become less effective. This is one reason constipation can sometimes appear alongside neurological conditions. Parkinson's disease, multiple sclerosis, spinal disorders, and certain nerve problems can affect the systems involved in bowel function. But constipation does not automatically mean a neurological disease is present. Far more ordinary factors can influence the same system. Physical inactivity is one example. When people move less, intestinal movement can also change. This becomes particularly relevant with aging. As people grow older, constipation becomes more common. Part of the explanation may involve changes in physical activity, diet, medications, medical conditions, and the digestive system itself. But aging alone does not explain everything. Two people can be the same age, eat similar foods, and have completely different bowel habits. So researchers have increasingly looked at another possibility. The gut itself may be changing. The microorganisms living inside the digestive tract interact with the food we eat and the environment of the intestine. Scientists have found differences in gut microbial communities among some people with chronic constipation. But this is where the evidence becomes more complicated. It is tempting to say that an altered gut microbiome causes constipation. The science does not allow such a simple conclusion yet. Some changes may contribute to constipation. Others may happen because intestinal movement has already changed, and some may simply be associated with the condition without causing it. That distinction matters, because the deeper we look, the more constipation begins to resemble a network problem rather than a single malfunction. Movement, nerves, muscles, water, medications, hormones, diet, microorganisms, and the physical structure of the colon can all become part of the investigation. Then there is another major suspect, medication. Many people do not think of their prescription medicines when they think about constipation, but several commonly used medications can slow bowel movement or make stool harder to pass. Certain opioid pain medicines are a well-known example. Some medications used for blood pressure, allergies, depression, neurological conditions, and other health problems can also contribute in certain people. This creates a difficult situation. The medicine may be treating one important condition while unintentionally affecting another part of the body. That does not mean someone should stop taking it. It means persistent constipation is sometimes worth discussing with a healthcare professional, particularly when symptoms begin after a medication is started or changed. And then comes one of the most important questions in the entire investigation. When does ordinary constipation become something that needs medical attention? Most episodes are not signs of a dangerous disease. Constipation can happen temporarily because of changes in routine, travel, reduced activity, illness, medications, or other relatively common factors. But certain patterns deserve more attention. Blood in the stool, unexplained weight loss, persistent or severe abdominal pain, vomiting, a major and unexplained change in bowel habits, or constipation that is persistent, worsening, or accompanied by other concerning symptoms. These signs do not automatically mean cancer or another serious disease, but they can change the medical investigation. This is where the story moves from everyday constipation to something much more important, identifying what has changed. Doctors may ask when the symptoms began, how often bowel movements occur, what the stool is like, whether there is straining, whether the person feels that the bowel has not completely emptied, whether medications have changed, whether there are other symptoms. Sometimes the answer comes from a surprisingly simple observation, the pattern itself. Because constipation is not defined only by how many times someone goes to the bathroom. A person may have bowel movements regularly and still experience difficulty passing stool or feel incomplete evacuation. Another person may go less frequently but have little discomfort. The experience is individual. And that is why modern clinical definitions focus on a combination of symptoms rather than one universal number. For people with persistent symptoms, doctors may sometimes investigate further. Depending on the situation, this can involve blood tests, imaging, colon evaluation, or specialized tests that examine how quickly and effectively material moves through the digestive tract. One of these approaches is particularly revealing. Researchers can measure how long material takes to travel through the colon. If movement is significantly delayed, the problem may involve slow transit. But there is another possibility. The colon may be moving normally, while the difficulty occurs closer to the final stage of evacuation. The muscles responsible for emptying the bowel need to coordinate correctly. If they do not, stool can reach the rectum but still be difficult to pass. This is sometimes called a defecatory disorder. And suddenly, the original assumption begins to fall apart. The problem was never simply not enough fiber. It was a problem of coordination. That distinction can completely change how doctors approach the condition, and it helps explain why one person's constipation may improve when a simple cause is addressed, while another person's symptoms continue despite trying many common approaches. There is still another question. Why do some people develop chronic constipation in the first place? For many, there may not be one single cause. Instead, several small factors can accumulate. Less activity, a medication, changes in diet, a slower digestive system, an underlying medical condition, altered bowel sensitivity, or changes in the muscles and nerves controlling evacuation. Each factor alone may seem insignificant. Together, they can create a persistent problem. This is one reason chronic constipation can be so frustrating. The symptom is visible, the cause may not be. And that brings us back to the mystery we started with. Someone can appear completely healthy. They may eat normally. They may have no obvious abdominal disease. Yet their bowel movements gradually change. Sometimes the explanation is simple. Sometimes it is a functional disorder. Sometimes medications are involved. And occasionally, constipation can be one piece of a much larger medical picture. The important lesson is not to fear the symptom. It is to pay attention to patterns. A short episode is very different from a persistent change that continues for weeks or months. A familiar pattern is different from a sudden, unexplained change. And constipation, accompanied by warning signs, deserves a different level of attention than ordinary occasional difficulty. The digestive system is constantly communicating with the rest of the body, and constipation can sometimes be one of the quietest ways that communication becomes noticeable. Perhaps that is why the condition has been underestimated for so long. It rarely feels dramatic. There may be no obvious emergency, just discomfort, straining, bloating, a sense that something is not moving as it should. But behind that simple symptom can be a surprisingly complex system. The colon may be moving too slowly, the muscles may not be coordinating properly, the nerves may be sending altered signals, a medication may be interfering with normal movement, or several factors may be acting together, and science still does not have a complete explanation for every case. That uncertainty is important. Medicine has become much better at identifying different forms of constipation, but there are still unanswered questions about why some people develop chronic symptoms and why treatments work better for some patients than others. Researchers continue to investigate the nervous system of the gut, the microbiome, intestinal movement, brain-gut communication, and the factors that determine how individuals respond to treatment. So perhaps the biggest misconception is the simplest one. Constipation is not one disease with one cause. It is a symptom produced by a complicated biological system. And once we understand that, the question changes. Instead of asking, "How can I make myself go?" the more important medical question becomes, what changed in the system that controls this process? For some people, the answer may be temporary. For others, it may require a proper medical evaluation. And in many cases, understanding the cause is more valuable than simply treating the symptom again and again. The bowel does not work in isolation. It responds to the nervous system, movement, medications, hormones, nutrition, and the changing conditions inside the digestive tract. That is why something as ordinary as a bowel movement can reveal so much about how the body is functioning. And perhaps the most reassuring conclusion is also the most realistic one. Constipation is common. Most cases are not a sign of something catastrophic, but persistent or changing symptoms should not simply be dismissed because they seem embarrassing or ordinary. If the pattern is new, severe, persistent, or accompanied by warning signs, a qualified healthcare professional can help determine what is actually happening. Because sometimes the body whispers before it shouts, and constipation may be one of those quiet signals worth listening to.